Did you personally take any steps to address your concerns about patient care
I started
other than report it to the administration?
So yeah, I definitely reported it. I also started kind of watching patient charts. I just couldn't sleep well at night. So I would read patients' charts. We had hired 2 brand new nurse practitioners who didn't have any cardiac surgery experience. So I encouraged them to ask if they had any problems with Dr. Sivadathan or rounding on her patients, best I could.
All right. So we have a lot of exhibits, and I will try to expedite this the best I can. I think they'll be useful for establishing a timeline and then filling in some of the details to the general overview that you've provided so far. So starting with Exhibit 7, which is at 0193. This is August 9, 2017. It's an email from Michelle Flemings to you. Who is Michelle Flemings? Or Flemings, rather?
Yeah, Michelle.
I'm sorry, is the exhibit up right now or no?
Oh, I'm sorry. I did take that down.
So Michelle Flemings was, so Brandy Ford, I'm really terrible at what their titles are. Brandy Ford was either a manager or director over our department.
Can I just ask, I'm sorry, what is the number of the exhibit? I can't see it on my screen.
Are you asking
Okay,
for the ERD?
194. Yep.
Okay.
Thank you.
And actually, I have complainants exhibit 7 is starting at 192, and it's an August 8th, 2017 email. So I just want to make sure. Okay, so 8/8/17 to 8/9/17. Okay, so it's part of that same. All right, go ahead.
So Michelle Flemings, so Brandy Ford was intermittently off. So Michelle Flemings was her replacement when she was not at work. So she was my direct report.
All right. And were you communicating with Ms. Flemings about your concerns concerning Dr. Sivadathan?
Ultimately, in 2018, I was. During these emails was when Bridget Tierney, who was the other PA that worked with us, left abruptly because of Dr. Sivadathan's behavior, and we were very short-staffed. I think at one point I worked like 34 days in a row or something. So this was an email asking when we were going to get more help at that point.
Okay, and do you have firsthand knowledge that this person left because of Dr. Sivadathan?
Yes.
How do you know that?
I talked to Bridget.
Okay.
Objection, hearsay.
Noted.
All right, and we are addressing the mitigation issue in a separate hearing, so I will not be referencing exhibits 6 or 8 at this time. Moving on to exhibit 9. Which is at ERD 0207. It's a February 21 to March 1, 2018 series of text messages. Is this first one a text message from you to Dr. Sivadathan?
Yeah, so I'm in the shaded area and Dr. Sivadathan's in the white.
All right. And can you tell us what is happening in this series of text messages?
So the top part was just normal conversation on how we talk on getting work done. And then this last part was her. So like I said, she had these outbursts probably like once a month, once every month and a half, where she kind of had a lot of aggression towards people, was irrational, a lot of yelling, and then things would kind of cool off for a while. She blamed it on what we call the diagnosis of PMDD, which is basically like a severe PMS version. So that's what she would always blame that on, but it wasn't consistent. But she would then apologize for her behavior at times, especially at this time, because it was she was acting much more severe than typical.
Can I just please get, we're on ERD 0209, is that right?
The one we were just talking about is at 208. Now we're moving on to Exhibit 10, which is at 0209. A April 2, 2018 email. And this is Dr. Sivadasan's email to you.
Correct.
Can you describe what's happening here?
So this is one of the emails. So this was after there was a patient that needed to be readmitted. She blamed me for that, obviously. And then she would send out multiple emails to multiple people, blaming them. And then after that, discussing what she felt in these long rambling emails about her feelings about things, and typically blaming people with it.
Do you agree with her that the readmission was your fault?
No.
Why is that?
Objection, I don't even understand what the question deals with. It's vague and ambiguous.
What the readmission was for?
Right.
Why don't you just back up?
I don't think we have a timeline here that makes sense to me even, but okay, so right now, the last exhibit we were on was 0209. Right now we're on,
The last one you asked about was 0208. So right now this is stamp 210.
okay,
So the timeline is April 2, 2018, as stated in the email. And the opening says, after our meeting today, I had a chance to reflect a bit. Was there a meeting around April 2, 2018?
Yes.
Okay. And in your testimony, you said that she was blaming you for the readmission of the patient. And you also testified that you disagreed with that. And then I asked you why you disagreed with it.
Well, this is a patient who Dr. Sivadasan discharged a couple weeks prior, who was an elderly female with renal disease, and she was discharged on oral Dilaudid. And she presented back to the clinic, basically snowed on narcotics, from a nursing home, and needed to be readmitted.
All right. And so
she ultimately went with withdrawals from that medication.
all right. And was there something in your experience, that was improper?
I don't think I've ever seen anyone get discharged on oral Dilaudid, especially as an elderly, frail female with renal disease. I wouldn't say it was grossly malpractice, but it's unusual.
Okay. And that was prescribed by Dr. Sivadasan?
It was directed by Dr. Sivadasan to one of the nurse practitioners to send her home on that, correct?
Judge, I'm gonna make an objection like I have before with regard to the fact that we're going back years with regard to a doctor and alleged allegations about malpractice, if we want to call it that, that really does not relate to this case. If we want to talk about what was complained about to management, that's different, but we're talking about evaluations by someone who we don't have an established idea about whether this witness is an expert in these areas, whether she can even testify to these issues. And we're going to go into great lengths to have testimony that relates to problems that did or didn't occur, whether we can prove it through expert testimony or not. But in the end, what this case is about is whether these complaints were made to management.
Okay, Mr. Olson?
Yeah, well, I need to lay a little bit of foundation before I can put it in proper context. So I am going to ask her about bringing this to the attention of management.
Okay, your objection is noted. I will give the evidence the weight it's due. You may proceed for now, Mr. Olson.
So this blaming of you for this readmission, did you bring this to the attention of the administration?
Actually, Brandy Ford was there during that meeting.
Okay. And that meeting, meaning when she blamed you for it?
Correct.
And then did you talk to Ford about the fact that you were blamed for it?
Yes.
And what did Ford say to you about that?
She just offered kind of support more than anything. She didn't really do anything about it, but she just kind of was there to listen, I guess.
Okay, we're now looking at Exhibit 11, which is at 0212. It's a April 4, 2018 text. And can you describe for us what is going on in this series of text messages generally?
So this was Brandy Ford checking in on me. Like I said, she was kind of just there for support at this point. And she knew I was having a hard time kind of dealing with Dr. Sivadosin's behavior and blame with that situation, among others.
So you talk here about hopefully I can get back to having peace because I still love my job. What did you mean by that?
I think this was the start of a very extremely stressful situation. I had a lot of anxiety about what was going on and what I wanted to do. And then I loved doing cardiac surgery. I liked working with everyone else on the team. I enjoyed my job. I was near to home. So I wanted things to kind of work out so I can continue to work there.
It's been implied that you and Dr. Sivadosin had a personality conflict. Do you agree or disagree with that?
I disagree with that. I think we were actually kind of friends before, or work friends best we could. I think it wasn't necessarily personality, it was just her aggression towards people were taking over, and especially when she learned that I was concerned about patient safety and talking to administration, that escalated quickly.
Right, now we're looking at Complainants Exhibit 12, which is ERD 0214. These are April 6 to May 29, 2018 text messages. And can you tell us what was happening at the time of this series of text messages?
So this is Brandy also checking in again right after that incident in early April. And she knew what was going on with Dr. Sivadosin. She gave me quite a support. And then at the end of it, we mostly emailed with each other. And then that last text message was in the end of May when things were horrendous at work. And I was reaching out to her and Susan Ventura, Nick Galich, and anyone in administration that would help fix the situation, basically.
Right now we're at Complainants Exhibit 13, which is at ERD 0217. It's a April 10, 2018 email. And this is from you to Brandy Ford. Why did you send this to her?
So Brandy asked me to send her any information that regarding Dr. Sivadosan, if she had any aggression or verbal abuse towards staff or clinical concerns. So I sent basically everything I could to Brandy. This is originally, it was just towards Brandy, and then Brandy asked me to also include Nick Galich as well, ultimately, but this was early on. So this was, Dr. Sivadosan had basically berated one of the OR nurses in front of everyone in the OR. So I wanted to make sure Brandy was aware of that.
All right, and Exhibit 14, I believe, was offered through Ms. Ventura. Is this a PTO request form
Yes.
that you had completed? And had you completed one for the last part of your employment?
No.
Okay. And was this the normal process you go through if you were requesting paid time off?
Correct.
At the end of your employment, did you ask to be on paid time off?
No.
What did they tell you in terms of the status of your leave at the end of your employment?
Susan Ventura told me to take as much time as I needed to figure things out. No one ever discussed PTO was being used. No one ever discussed anything else. I think Susan even her testimony also agreed with that, where she told me to take as much time as I needed to recover from the situation with Dr. Sivadosan. But no one informed me that PTO was being used. It started at a random time during my leave. It was one of the things that made me very upset when I found out that they used all my PTO without my knowledge.
And now we're looking at Complainants Exhibit 15, which is at ERD 0221. It is an April 17, 2018 to May 23, 2018 series of text messages. And this was introduced through Ms. Pfeiffer this morning. Can you tell us from your perspective what was happening during this series of text messages?
So this was a time that administration wanted to discuss things further with me. So I had a meeting with administration, so I was unable to be in the OR at the time. So that was me communicating with Angie regarding that. And it was also us discussing what was going on. And Angie was kind enough to kind of help morally support me during that time. I was pretty stressed. That she was, and the OR team was very supportive and made work okay.
So here you talk about, I truly love working here and with you and the team. That's the hardest part. What were you referring to there?
At this point, it was being more and more difficult to come to work. And even though I loved what I did, I loved the team, I loved what I was doing. But at this point, it was just getting more and more difficult to show up to work and take the verbal abuse.
All right, and the date here is April 19, 2018. And we scroll down to ERD 0225. You're talking about a meeting here, big one with me next week.
I believe
Uh,
that,
Go ahead.
I believe that's the meeting with Dr. Folin, as well as Susan Ventura, Nick Galich, and Chris Leslie, where I presented all the clinical information to Dr. Folin for his review. And that's where I gave him all of the medical records of all those patients that had concerns attached to them.
All right, so just to pin down the timeline, that meeting would have occurred the week following April 18.
I think this one, that big one was at the end of May.
Okay, so this date here, do you know if that reflects the message above it or the message below it?
Well,
If you know.
it should be the one above it, I would
I
think.
see. Okay. So your recollection is that the meeting did occur at the end of May, which would have been the week following May 23?
Correct.
And then here you say shit is hitting the fan. What were you referencing there, if you know?
I think it was just pure chaos in the clinic. Dr. Sivadosan was already yelling at everyone. I think she dropped an F-bomb at Bessa that day. It was just terrible.
All right, we're now looking at complainants exhibit 16 found at ERD 0227. These are emails dated April 18 through May 3, 2018. And this first one is from you to Ford and Galich. Is this
Correct.
you again reporting to them what is going on in real time?
Correct.
And the redacted, is that patient info or something else?
Yeah, that was a patient name.
All right. And then in the last paragraph, you make reference to a patient still waiting here. Why was that significant?
So Dr. Sivadosan wanted all of the patients to be in our clinic and get labs drawn that same time. She wanted the patients to wait until their labs and x-ray were completed before they would leave, which often took, I mean, it was outpatient lab, so it took 6 hours. So we would have patients who were after open heart surgery sitting in our lobby for 5-6 hours at times, waiting for just labs to be done.
Okay, and at ERD 230, on April 19, Ford says to you, would you like me to work with Glenn to set up a meeting to review order sets for Epic? And I'll be present. What was that about?
There was a previous meeting with Glenn. I'm blanking on his last name. He's with Lab. And it was myself and Dr. Sivadosan, and Dr. Sivadosan just went crazy on Glenn, started swearing at him during the middle of a meeting that was a very benign meeting. It was about order sets. And she just kind of went nuts on him. So we wanted another meeting to review order sets, and Brandy was offering to be present just in case something similar to happen, because I think Glenn was pretty shook up from our last meeting, which probably happened at least 6 months prior to that.
All right, and you sent another email on April 19 at 2:39 p.m. to Ford. Is this self-explanatory? You're reporting to her in real time what's going on with Dr. Sivadosan?
Correct.
And here at page 0231, she's telling you to keep her in the loop.
Correct.
Is that consistent with what you talked about before, that they wanted to have you report to them what was happening with Dr. Sivadathan?
Correct. They wanted everything in as much in real time and to report to Brandy and Nick as much as possible.
Okay, and here you're referring to a patient's chart in an email at 12:39 p.m. on April 19. What's the significance of this?
This is one of the episodes where Dr. Sivadathan actually yelled at a patient's family member. The patient wanted, or the patient's family wanted the patient to be comfort measures. They were dying. Dr. Sivadathan did not want to make them comfort measures, and she actually yelled at the patient's family member, which was horrifying because she was losing her mom. And then Dr. Sivadathan refused to see the patient or the family for the remaining of their hospital stay.
All right, and at 0232, you can authenticate this as your email to Ms. Ford again, reporting to her
Correct.
additional problems, and those speak for themselves, I believe. And moving on to Exhibit 17 at ERD 0235. These are emails from May 8 to May 31, 2018.
You're gonna have to slow down just a little bit, Mr. Olson. It's very hard to get this reported in all the places that I need to.
Yes.
Okay,
Would you
so
like
can you
to
pull
go-
back up? Okay, up, just
the number?
down, down.
Okay.
No, I have the numbers. I need the title.
Okay.
Okay, go ahead.
Okay, and this is an email from you on May 31 to Ford, Ventura, and Galich. Can you tell us the significance of this?
Yeah, so this is me reporting things I heard about what was going on. So this was an occurrence. So this happened the same day I was supposed to meet with Dr. Fullen. It was either the day before the day of I was meeting with Dr. Fullen. So Dr. Sivadathan refused to have me in the OR, which was fine. They had 2 surgeries at St. Catherine's, which is the hospital in Pleasant Prairie that morning. Dr. Sivadathan wanted the entire CVOR team to be there for a meeting. When the team requested that Chris Leslie and Kathy Turk to be present, which is the administration over the OR, Dr. Sivadathan got upset and decided that after spending the whole day at St. Catherine's, that she wanted to move the meeting over to Kenosha Memorial, which is in the downtown hospital, just to make it difficult for administration to show up.
How do you know that's why she did that?
Because she decided to move it right after Chris Leslie told her that she was going to be present.
Okay, and
I was
So
disinvited to the meeting.
you were disinvited?
Yeah, she wanted the whole OR to show up, but then she told me I was not allowed to show up.
What did you do with that information, if anything?
And I sent an email to Nick, Susan, and Brandy.
Did they do anything to address the situation that you're aware of?
No.
And then you say, I'm concerned about retaliation. Did you experience any retaliation from Dr. Sivadathan?
Objection. the word retaliation is a legal term. I've
Right.
been letting
can-
so much of this
Okay.
go, and
I'll rephrase it.
Go ahead and rephrase.
Yeah, did Dr. Sivaдаsan have a negative reaction after you brought your concerns to the administration?
Very much so. Her behavior became much, much worse. I think the day after this and the day or two after I met with Dr. Fullen was when she was telling everyone that in the ICU, not only the OR, but then the ICU, that I was fired.
All right, and on May 29, you sent to Nick Galich this email at 7:51 a.m. Why did you send it to him and not to the other people?
I sent it to Brandy as well. I forgot to include Nick in that one when I sent it to Brandy.
I see.
But I try to send it to both of them with what I was instructed to do.
All right, and on May 21 at 9:01 a.m., you sent this email to Ford. Is that right?
Yeah, that was a patient we discussed previously. That was the dissection patient that had quite a few issues with poor decision making. And then Brandy asked me to forward the MRN number to her. The nursing staff also documented in the EMR system about their phone calls with Dr. Sivaдаsan with swear words that were directed at that nurse taking care of the patient at that time, which was documented.
Okay, now we're looking at ERD 0239. This is a May 8, 2018 email from you to Ford and Galich at 10:02 a.m. And I don't want you to read the document into the record. Is there anything here that is not self-explanatory or that requires more detail for context?
I don't believe so. This is just her outbursts with other people.
Mm-hmm.
And at the end of it was me asking for help because it seemed like no one was doing anything to help us.
And did they respond or provide you with any assurance that they were fixing it?
No.
Now we're at Exhibit 18 at ERD 0241. This is a May 9, 2018 text.
Can you just stay there for a moment?
Yes.
Okay, thank you.
And this was an email from you to
I think it's a text.
Bessa. Did I say
Yeah, it's a-
email? Yes, text.
Yes,
You to Ms. Aligi, correct?
correct.
All right. And from your perspective, what was happening during this time period?
I think both Bessa and myself were pretty stressed at this time. We were both talking with administration, and then that digoxin patient was patient Dr. Sivaдаsan started a couple medications on a patient that were contraindicated, and the patient needed to be readmitted to the hospital. And then she blamed Melissa, who was our brand new nurse practitioner, about that situation.
And now we're at Exhibit 19. The number is ERD 0245. This is a May 11, 2018 text.
Okay, thank you.
And this is text from you to Ms. Aligi on May 11, is that right?
Correct.
And what's the significance of this series of communications?
This was both Bessa and I going to Brandy about our concerns about Dr. Sivadasan. And then, as you can see, Brandy was having personal issues at the time, so she didn't show up or canceled a lot of our meetings as well. Hence, the emails were more important to send, keep her informed because she wasn't at work all the time.
Okay, moving on to Complainants Exhibit 20, which is at ERD 0247. This is a May 14, 2018 text message.
Okay, thank you.
And this was again a text from you to Ms. Aligi on May 14, 2018.
Correct.
And can you tell us what was happening during this time period?
This was us trying to set up another meeting with Brandy.
Moving on to Exhibit 21 at ERD 0249. This is a May 16, 2018 text.
Okay.
And can you tell us what this is about?
So Bessa had time to meet with Brandy that day. And then Bessa also wanted Brandy to come to our team meeting. I think that's the meeting where I wrote on all of the PA responsibilities. That's when that Brandy showed up on Monday for that following Monday.
And what was the significance of that meeting on the following Monday?
It was Dr. Sivadasan wanted to have a team meeting again to discuss responsibilities of the nurse practitioners and the PAs, as well as Bessa. Those responsibilities often changed and sometimes weren't coherent. So Brandy was asked to show up for any of those meetings.
And now we're at Exhibit 22, which is ERD 0252 to May 18, 2018 text.
Just 1 second. What was the Bates?
0252.
All right, thank you.
And this may help us establish a timeline concerning meeting with Dr. Trimark. You've talked about that already.
Yeah, so I had I think 3 meetings with Dr. Trimark, and then Brandy told Bessa to have Brandy on the phone when I met with Dr. Trimark the first time, which ultimately didn't happen, but I met with Dr. Trimark that day.
So Dr. Trimark, if I recall from yesterday's testimony, said there were 2 meetings with you. Do you agree or disagree with that?
The last 2 were the most important, where we discussed more of the clinical issues with Dr. Sivadasan. This first meeting with Dr. Trimark was one of our semi-routine meetings. He was helping us with STS insulin optimization. So Dr. Trimark, myself, and the STS nurse analysts that were data gatherers met on a routine basis. So after that meeting, Brandy wanted me to discuss some of the concerns I had with him after that STS meeting too. But there was 2 meetings with Dr. Trimark specifically just regarding Dr. Sivadathan's behavior.
Next exhibit is Complainants 23, found at ERD 0254. It's a May 18, 2018 transcribed voicemail.
Can you state the bait stamp numbers again?
0254
Thank you.
Is this a voicemail that you received from Ms. Ford?
Correct.
And can you describe generally what this is about?
This was Brandy telling me that she was not going to be available by phone with my meeting with Dr. Trimark. Brandy wanted me to discuss some of the things with Dr. Trimark during that meeting with her prodding. So that was that first meeting with Dr. Trimark where I started discussing those issues.
Where was your first meeting with Dr. Trimark?
It was in his office, which is directly next to this cardiac surgery office.
And how long was that meeting approximately?
The STS portion was probably like 45 minutes, and then the discussion about Dr. Sivadosan was probably additional 20 minutes or so.
And what did you discuss with Dr. Trimark in that first meeting?
I think it was just kind of an overview of her escalating behaviors, my concerns about her verbally being abusive to the staff, as well as a couple of the concerns I had, just overview on some of the clinical concerns about patient care. I didn't provide any details at that meeting for him, but I kind of just did a gross overview of what was going on with him, so he was in the loop.
Did you and Dr. Trimark discuss at the conclusion of that meeting what the next steps would be?
He said that he was going to discuss with administration to see what he can do to help.
When was the next time you had communication with Dr. Trimark?
I think it was the last week of May.
Did you have another meeting at that time?
We did. We had two back-to-back on 2 days.
Okay. How long was the first meeting?
It was probably close to an hour,
And how long was the second meeting?
probably also close to an hour.
Okay. And during the first meeting, what did you discuss? Or rather, we're talking about the second meeting, but
Yeah.
the second of the three.
That meeting, that's the meeting I showed him the same documents I showed Dr. Folan. We discussed specific patient issues and my concerns with some of the patient care, as well as the patient deaths and readmissions and things like that. In the conclusion of that meeting, he asked me to show up the next day so we can review. Dr. Trimark's really great he likes straight data and things that he can look at. So he wanted to look at STS data to see if there's truly patient concerns that would be reflected in the STS data, which basically collects any morbidity and mortality for cardiac surgery patients. So he wanted to meet the following day with the STS analysts who printed out the STS data for him. And then we reviewed the STS data, which showed obviously high mortality rates and morbidity rates for the last 2 quarters.
And what was the significance of that based on your discussion with Dr. Trimark?
Dr. Trimark, after it was expressed that he was very concerned about that information, with her increasing instability, with her issues with patient decision-making, with the high mortality rates. The typical mortality rate for a cardiac surgery program is about 1%. We were running at 15%. He was very concerned. He's at the end of that last meeting, he said that he was going to discuss with the board with what he was finding. And that last meeting was the same day I asked for a transfer. So he
Judge, I'm just going to object again. I've been trying to stay off of the record with these objections, but I have to say that not only is this hearsay, but we've got nothing going towards where we're supposed to be when it comes to the retaliation complaint. And whether she was a good doctor or not a good doctor, we're hearing the same things over and over again. And I just need to state the objection over.
Okay, thank you. Your objections are noted. With respect to hearsay, obviously the answers have been provided. Additionally, the hearsay objection in administrative hearings, as I'm sure you're both aware, we can accept hearsay evidence into the record. We give it the weight it's due. If there's no obviously corroborating evidence, then there's nothing to it. But we give that the testimony the weight it's due as we make our decision. With respect to your other evidence, I understand that I think we started going through these exhibits to establish a timeline. It's not always been consistent, like in order. I understand that Mr. Olson is trying to go through all the exhibits to get them in. I would ask that he try to narrow his focus to what is at stake in this hearing. Whether you do that just by asking the complainant of her time, with respect to the timeline herself and filling in with the exhibits as necessary, or just streamlining and focusing as we go through these exhibits.
So you mentioned that there was a meeting you had with Dr. Fullen that preceded your meetings with Dr. Trimark. Is that right?
Yeah, it was a day or two prior.
And did you review any documents with Dr. Fullen?
I had a whole folder full.
And did you show those documents to Dr. Fullen?
I gave him the whole folder.
Okay. And did you discuss those documents with Dr. Fullen?
I did.
Did Dr. Fullen provide any opinion as to any clinical problems that you had raised?
He was pretty quiet during the meeting. They wanted me to go over those documents with the whole administrative staff. And then at the end of me reviewing those documents, I was asked to leave. So I don't know what happened after that point and what they discussed, if anything.
So there were other people present when Dr. Fullen was there?
Yes, that was a meeting with Dr. Fullen, Chris Leslie from the OR, Susan Ventura and Nick Galich were all there.
And when was that meeting?
I think it was like May 29th or May 30th of 2018, something like that.
And how long was that meeting?
Probably like 45 minutes, somewhere around there.
Oh, okay.
Half hour, 45 minutes.
And this is Complainants Exhibit 24 at ERD 0256. These are emails from May 22, 2018 to June 7, 2018.
Thank you.
And can you tell us what was happening during this time frame?
Yeah, so this is after I asked for a transfer, which was on a Friday. They was asked to, reached out to administration that following Monday to get an update. I didn't get anything. I then sent out an email again and a text to Brandy and Michelle Clemens. And finally, they asked me to reach out to Susan Ventura to set up a meeting. So this was me talking to Susan and her administrative assistant to set up that meeting.
Complainants Exhibit 25 is ERD 0262. These are May 29, 2018 text messages. This was previously admitted.
Go ahead.
And what was happening during this series of text messages?
So this must have been, right, so May 29th must have been the date I met with Dr. Fullen and the rest of administration. So that was talking to Angie about that I did have a discussion about the clinical concerns with administration.
All right, so we can pin down that date of the Fullen meeting as May 29, is that right?
Correct.
Complainants Exhibit 26 is at ERD 0267. This has been previously admitted as the May 29, 2018 meeting notes. Do you know who created these notes?
I did.
And were these notes provided to anyone in the administration?
Yeah, so this was in the folder I gave to Dr. Fullen and the administration during that May 29th meeting. So this was just kind of like a summary version of that. And then I also printed out all of the actual EMR documents that pertain to this information as well.
All right, and going through those first 4 bullet points, what was the significance of no rounding on her weekends?
I think that was one of
Let me narrow it down to this. Did your complaint about no rounding on her weekends relate to the health or safety of patients
correct.
also?
So there was only 2 of us at this point. It was myself and Dr. Sivadosan that covered cardiac surgery for Froedtert South. So we split weekends. Unfortunately, frequently on the weekends that she covered, she would not actually see any of the patients, which was terrifying.
Why is it terrifying?
So Dr. Sivadosan didn't get along with other physicians at Froedtert South. She did not want any consultants on her patients. So the only providers that were seeing postoperative open heart surgery patients were us. So these patients were not being seen by any provider for an entire weekend.
After they had open heart surgeries?
After they had open heart surgery.
All right, and does her not seeing patients prior to surgery have any effect on, or did it relate to your complaint about patient health or safety?
Correct.
How so?
There were a few instances where she would have the patient go to the ER or the OR without actually seeing them. For instance, we had one patient, she asked me to get scheduled for a pericardial window. And I got to the patient's room and I looked at the CT scan and the patient didn't even have a pericardial effusion to do a pericardial window on. And she wanted the patient in the room before she arrived in the OR room. So that patient would have had unnecessary anesthesia, unnecessary surgery because Dr. Sivadosan never actually saw the patient before.
No orders on weekends, how does that relate to patient health or safety?
That goes hand in hand with her not seeing the patients. So if she doesn't see the patients, then it's very difficult to put orders in or adjust medications or do what the patient medically needs. So she just physically would not put any orders in.
Okay, and then the 4th bullet point refers to aortic dissection in CABG patient. What's the significance of those terms?
Yeah, so Christine was one of our brand new nurse practitioners. She was a family practice. She had no cardiac surgery background. She didn't have a cardiology background even. So it was, I think, her first or second week on the job, and Dr. Sivadosan had Christine round on these patients. And then it made me very uncomfortable that Dr. Sivadosan or another provider never saw those patients, especially.
Are you okay? I'm sorry, just hang on 1 second. My daughter's home.
Sure.
Okay, all right. Sorry about that.
Sorry.
So especially aortic dissection patients are very critical patients. They are probably one of the more complex patients for cardiac surgery, and the CABG patients are open heart procedures. So you have an inexperienced nurse practitioner on her first week on the job, rounding on patients with no other provider seeing them.
All right, and I want to go through this list very efficiently. So can you pick out from patient number 1 as concisely as possible what the health or safety issue was there?
This was one of the bigger ones that I was concerned about. We had an aortic dissection patient, which is basically the largest blood vessel in your body tears and you bleed into that same blood vessel. These patients are critically ill. So the treatment plan for those patients are, if that affects a certain part of the aorta, is emergent surgery, which this patient had. But the second part of treatment is very intensive blood pressure and heart rate control. Typically, you want their blood pressures as low as they can tolerate. Unfortunately, the patient had a dissection that affected his upper arms, so his blood pressure cuff was inaccurate. And Dr. Sivadosan kept repeatedly placing this patient on max dose IV blood pressure increasing medications. So this patient's blood pressure on his legs is well over 200, which is terrifying. That would possibly cause the patient to have a rupture and die immediately, cause worsening of dissection. And every time I talked to her, she would agree. We would turn off the IV medication, and then she would restart it later on. So she kept reordering it. And then finally, on the last day, I told her, I'm like, this patient's back on this IV medication. And then that's when she started yelling at the ICU nurse for following her orders and restarting it. And basically berated the nurse about it. We're fortunate that the patient didn't die from it, which was great.
Okay, and I don't need for number 2 a tremendous amount of detail, but just as concisely as possible, what was the safety or health issue there?
She wasn't actually reviewing the patient's labs.
Okay, number 3, health or safety issue there.
Oh, this was an interesting one. So Dr. Sivadosan didn't want to round on the weekends on this patient. The patient was in the ICU on Thursday on 2 different IV medications to help support their blood pressure, was on oxygen. On Friday, because Dr. Sivadosan was on call for the weekend, didn't want to round on, and she told the nurse to just turn everything off and discharge the patient.
Why was that bad?
It's pretty extreme to go from 2 IV blood pressure supporting medications and oxygen to nothing, and then be sent home with just fingers crossed.
Patient number 4, what was the health or safety issue in a nutshell?
This was a digoxin patient that Dr. Sivadosan blamed Melissa, the nurse practitioner, about, where she started medications on patients that were contraindicated, and the patient required readmission.
And how do you know that medications were contraindicated? Do you have training in that regard?
I do.
Patient number 5, what was the health or safety issue there?
Oh, that was that pericardial window where she didn't see the patient before. And she wanted me to have the patient be brought back to the OR.
Patient number 6.
So Melissa and Christine were the 2 nurse practitioners with no previous cardiac surgery or cardiology experience. So they were seeing and rounding on patients, and then Dr. Sivadosan never actually saw those patients with them or laid eyes on the patients, which was concerning.
Was it a concern that these individuals were seeing patients who didn't have an adequate training or experience?
Correct. Typically, you don't see patients independently in the ICU as a new nurse practitioner with no experience until probably 6 months, a year into it.
Patient number 7, what was the health or safety issue there?
This was one of the bad ones, and this was one of the things that I originally was that I was concerned about, made me concerned about patient decision-making from Dr. Sivadathan. This is a patient that ultimately died. She was a post-op patient who bled. She went into cardiac arrest. There was a large window where Dr. Sivadathan could have brought her back to the OR for the bleeding. She didn't bring her back until the following day. By that point, she had a very large stroke and ultimately ended up passing from that. And it was a fairly obvious bleed.
Patient 8, health or safety issue?
So Dr. Sivadathan set this patient up for an endovascular abdominal aortic aneurysm repair. She didn't actually see the patient in detail. She didn't review any of the patient's history. And the patient had an endo AAA, even though the patient was on hospice, and he had 2 different end-stage GI cancers at the time, which would preclude him from any intervention because he's on hospice.
So was that an instance of providing medical care that was in excess of what was allowed?
Of her not reviewing any of the patient's information before actually operating on them.
But you said something about the individual not being eligible for intervention?
Yeah, typically you do not intervene on hospice patients unless it's a pain relieving or a symptom relieving procedure. This procedure is just preventative from a rupture. So
was it an instance of providing unnecessary medical care?
Typically, yes.
And patient 9, what was the health or safety issue there?
This was a patient that Dr. Sivadathan told the nurse practitioners to start a patient with Raynaud's, which is a disease that causes vasoconstriction of fingers and toes typically. And she started a medication on that patient to cause further vasoconstriction. I saw the patient that following weekend for the first time, and the day before they started noticing that her toes were becoming blue and not being perfused. They ordered ultrasounds, and then by the time I saw her that weekend, she had almost necrosis of her toes, and I stopped the midodrine, which was causing that. The last time I saw that patient, she was being seen by, I forgot it was wound care or vascular surgery, and they were debating whether or not to amputate those toes.
So what was it that Dr. Sivadathan did or didn't do that was improper?
Well, she started midodrine on a patient with Raynaud's, which you have to do with caution. And then once they saw that the patient was having poor perfusion to her toes, they should have stopped that medication immediately.
Patient 10, what was the safety or health issue there?
This was a patient on a weekend of Dr. Salenzi's who came in. She was an elderly female. She had a large heart attack, which caused her left ventricle to rupture. So she had a hole in her heart that was bleeding into her pericardial space. She was in tamponade, which means part of her heart collapsed and no blood flow was getting into her heart. Therefore, no blood can get out of her heart to supply blood to the rest of her body. Dr. Sivadathan didn't show up for that emergency for over an hour. And then afterwards, we kept working on this patient with a hemoglobin of 2, who was, I think it was 3. And then we were doing compressions on her for over an hour before Dr. Sivadathan showed up, which.
Did she, well, what was improper about her not showing up for an hour?
Typically, if you're on surgical call, you have to be within within the hospital radius by 30 minutes.
Were there other instances when Dr. Sivadathan was not where she was supposed to be?
Multiple. There's multiple occurrences, especially in 2018, where she did not show up to emergency surgeries for over an hour.
Patient 11, what was the health or safety issue there?
This was a patient that Dr. Sivadathan set up for a vascular surgery. And that was a quote that she even told me. She said, "Why did I even do surgery on her? Because the patient was wheelchair bound. So what's the point of doing vascular surgery on a patient who isn't ambulatory?"
What's wrong with that?
Typically, you don't do surgery on wheelchair bound patients with no claudication because they're not ambulating.
And patient 12, what was the issue there?
Oh, that was the same thing with Christine and Melissa seeing patients without Dr. Sivadathan actually seeing the patients with them.
And patient 13, what was the problem there?
So Dr. Sivadathan wanted all of the atrial fibrillation patients post-operative. She asked BESA to send all of those patients referral to Dr. Chowdhury, who's an electrophysiologist, which is fine. But none of those patients knew that they were being sent there. None of their cardiologists knew they were being sent there. So it was just kind of a fiasco with basically making all of our referring cardiologists very angry.
All right, and you heard Dr. Trimark testify yesterday that you identified for him 4 or 5 issues. Do you agree or disagree with that?
Objection, vague and ambiguous. I've been restricting the objections here, and I'm going to at least object to that question.
Okay, can you repeat the question, Mr. Olson?
Yes. You recall Dr. Trimark testifying yesterday that you identified for him 4 or 5 clinical problems?
Yes.
And you
Again,
agree or
objection.
disagree with that?
4 or 5 clinical problems is vague and ambiguous.
I didn't find the original question that vague or ambiguous, but I wanted him to repeat it because I didn't record it. I mean, I didn't write it down, and I have no way of playing back the recording. So I guess, Mr. Olson, just ask the question as specifically as you can.
Sure. Do you agree or disagree that you identified for Dr. Trimark only 4 or 5 clinical problems with Dr. Sivadathan?
But we reviewed 4 or 5 in detail, but I showed him all of these.
Okay. And you actually gave him the document?
I had it with me, but I don't think I gave it to him for him to keep.
Okay. Did you give it to Dr. Fullen and the administrators to keep?
I did.
Okay. Do you know if Dr. Trimark had communication with Dr. Fullen about the issues that you brought forward?
I do not know.
Okay.
I know he said he was going to talk with Rick Schmidt and the board, but I don't recall anything about Dr. Fullen.
Okay. And at 20272, is this a continuation of your notes?
So I had 2 separate notes. So that first one that we just reviewed was just clinical issues. And then this second one, so the administration asked me to separate clinical issues with clinical and behavioral issues. So the second one was also including behavioral issues that was going on as well.
And did you provide this with the folder or notebook that you gave to Fullen and the administrators?
Yes.
And this goes down through ERD 025, strike that 0275. Is that correct?
Yes.
We're at exhibit 27, which is starts
Why
at
don't-
here.
Excuse me, why don't we take about a 10-minute break at this point, okay? Before we
Sure.
start the next exhibit, all right?
Okay.
So 2:30, all right?
All right.
Great,
Okay,
thank you.
thank you.